Well, that's the
So, yeah. So,
Okay.
at any rate, we're all aware of the depressing.
He may not know the rules.
Let him do it whatever he wants. There are any rules. He can be behind the podium if you want.
No, but I'm talking about your timing and the moving your car.
Oh, I'm sorry. You're right. I think you knew. I think you've got 10 minutes total time. You're right, though. The only thing that I'll do is at the end of the fight, you're right. Thank you. At the end of the fight, that's when you've got 5 minutes left. Okay. And then you've got 1 minute. Then you got a stop time. And then you have 5 minutes to take questions. So you got 15 minutes total.
Okay.
Sorry, yeah, but
You're right.
You were here this morning.
It's not going to make any difference to me anyway. We've got so much to say.
Okay.
Okay. You know, I think we are all aware of the depressed logging industry here in the state of Washington. And I'm sure many of you may also think that applies to the pulp industry, too. Well, I'm here to tell you that the pulp business is going strong in the dental specialty area of endodontics. Now, I'm obviously not going to talk to you about sawdust today, but just as wood pulp forms the internal aspect of a tree, as an endodontist, I deal with the pulp or the soft tissue and nerves that form the inside of a tooth. The 3 basic things that I'd like to get across this afternoon are, what is an endodontist, what does an endodontist do, and why the need for endodontic treatment. First of all, an endodontist is a dentist who limits his or her practice to root canal therapy and procedures that concern the inner soft tissue of the tooth. An endodontist has 2 additional years of specialty training and/or has been certified by the American Board of Endodontics after passing a rigid series of examinations. He or she is specifically qualified and trained in diagnosing and relieving dental pain and infection, treating physical trauma to the tooth, performing routine root canal procedures, bleaching discolored teeth, and performing certain types of oral surgical procedures generally aimed at eliminating dental pain and infection. Now, I'll bet that despite that elaborate list of things that I gave you that we do, many of you have just tuned in onto the well-known phrase root canal therapy. And that's good, because now that I have your attention, I'd like to talk to you about the many types of dental treatment that endodontists do perform. A moment ago, we talked about the dental pulp. That is the soft tissue within the hard enamel and dent and tooth structure. In effect, this tissue is contained within a small hollow space or canal, and this is the root canal of the tooth. When the pulp of the tooth becomes diseased, dead, or dying, an endodontist treats this problem by doing root canal therapy. So our therapy is directed at the internal aspect of the tooth. If left untreated, this tissue would soon act as an irritant that would in turn create an infection or abscess in the bone surrounding the tooth. The skill and training of an endodontist allows him to remove the irritant from the root canal of the tooth and in effect save that tooth. The process is very similar to removing a sliver from the soft tissue of your finger. Once those irritants are removed, the redness and swelling and infection is allowed to heal. Now, what causes the need for root canal treatment? Basically, the reasons for endodontic treatment are any type of injury that causes damage to the pulp of the tooth. Now, most often, this damage takes the form of deep decay and fillings. However, we also see very many patients that have sustained physical trauma or injury to the tooth. Now, I'm sure that many of you can relate to the sound of the pathetic pleas of your 16-year-old boy as he begs you for the keys to the family car. And to make a long story short, after he promises you everything, including his firstborn child, which you don't want anyway, you finally relinquish those keys. The next thing you know, the car's in the body shop, your insurance rates have tripled, and your son is going through a major life crisis because God's latest gift to 15-year-old girls has a chipped front tooth. Well, without root canal treatment, your son would indeed have a lifelong problem. The pulp of the tooth would predictably become inflamed and die. An abscess would develop around the roots of the tooth. We'd end up seeing the tooth either requiring root canal treatment or being extracted. If the tooth is lost, we're faced with more extensive and expensive dentistry in terms of bridges and aesthetic replacements for that tooth. So isn't it wonderful that the endodontist was there to save your son's tooth? It almost makes you wish we were moonlighting in the auto body business too, doesn't it? I also realize that another reason I might have your attention is that many of you may associate root canal treatment with pain. And I know that there is no other attention getter quite as good as pain. The truth is that the association of root canal treatment and pain is the biggest misnomer since the rumor that chickens have lists. And incidentally, I have treated a few chickens in my office that do have lists. It is very true that patients do come into me with pain. But the fact is that root canal therapy allows them to leave in comfort. With gentle caring techniques, modern anesthetics, the vast majority of patients do not have any problem at all with root canal therapy. And after all, there are worse canals than root canals. We have love canal, and unless you happen to have a particular affinity for toxic waste products. And really, the only good canal we've ever had was the Panama Canal, and Jimmy Carter just gave that away. So if you plan to save your teeth and keep them for a lifetime, root canal treatment may be the most important relationship with a canal that you will ever have. So my departing recommendations to you are invest in Pulse and root for your local endodontist. Oh. Plagiarize that one from me. Greta?
Oh, this all sounds fine, but I don't understand why I can't just go to my general dentist and have the procedure done.
Well, I think that depends on the general dentist's personal expertise in the procedure. Certainly general dentists do a great deal of root canal therapy, and I think the decision on what tooth to do, what complications he can handle, depend on his personal assessment of his expertise. Certainly as an endodontic specialist, we tend to see the majority of complex cases, and I think the situation may be analogous to a general physician and a dermatologist. He'll treat a bulk of the rashes that come into his office, but when a situation is assessed as more than he can handle, he would send a case on to a dermatologist. Same type of thing is true with root canal therapy. Any other questions?
Well, what are the fees, Dr. Reid, for root canal? How do your fees differ from general dentistry?
Well, it varies. I think some of the things that create differences are, regional differences where the individual lives in the United States. I think by and large, endodontic fees are higher than general dental fees, and I think they range from $100 to a very simple tooth up to $300 to $500 for more complex teeth. And I think the advantages there speak to the skill and training in delivering a very predictable result that the endodontist can deliver. Any other questions? Am I off the hook, Red?
What do you think? I would tell you that pretty much this is the kind of presentation that although you can always use visuals because visuals do help, but this is the kind of after lunch presentation, after dinner presentation where they've asked you to come in for 10 or 12 minutes and talk to them about a various topic, and you can literally get away without having to have visuals. Setting up visuals in any case, no matter what they are, does take time. You saw how long it took us to set them up this morning. And you have some very nice turning of phrases that work well with the audience. What do you think of them?
I'm amazed over you how many hours you spend that. You could rattle that off the top of your head. You're a genius. I love those things. Those are great.
Yeah,
For the pulse. The pulse is great. We are official writers.
Okay.
somebody needs to take some of yours and probably make visuals out of them. They're great little phrases, and they could work very well.
Comparing the canal with other canals.
Sure. In fact, that's possibly a great title. There's all kinds of things that you could do. That canals I have known and loved, and those kinds of things. You could do all kinds of things with that. And I think you're beginning to see that you do have an option of being able to put some presentations together, especially for lay audiences, that are not only informative, but that are also interesting. The only thing I would have told you that I would have done, you had a great opening, and then you gave me a long medical explanation of what an endodontist was. You would have been a lot better off giving me the example of the 16-year-old boy. In other words, by saying, I'm here and I'm an endodontist. Now, a lot of you probably don't know what an endodontist is. Let me tell you a short story. And then go into your story of your 16-year-old son, because from a layperson's point of view, I didn't remember a single thing that you said about your medical term or your dental term of what an endodontist
I've noticed
is.
just at Rotary, where guys will get up and supposedly talk on a subject, and they just end up telling jokes, for 20 minutes, and they go over really big, and I kind of get caught between the professionalism of, delivering a straight line and spiel, and, just not taking myself too seriously and just trying to be light and entertaining. So, and obviously I don't have that down very well. But
I would have flipped it around. I don't know that you would. What you might have wanted to do is to gone back and given me the technical definition later on in the presentation, but the worst thing that you can all do as speakers is to try to give me a technical definition at the beginning of your presentation.
okay.
It's just not the right place to put it. I'm not asking you to take it out completely, but I am asking you to grab hold of the audience, recognizing that Americans, do you know what the Americans' average attention span, I know the two of you should know because I told you in the media class. Do you know what the Americans' average attention span is? Any of you?
They told us earlier today that it was about 10 minutes.
12 minutes.
Well, 10 to 12 minutes was awesome.
That's our average attention span. And if you can't catch us in the first 3 minutes, you don't even have us for 12 minutes. And that's why it's so difficult to organize some of these presentations for maximum impact at the very beginning, because we don't have the option anymore of lecturing. Most of us, if you look back at your college days especially, we were captive audiences for an hour or for 2 hours in a biology lecture, as an example, where we did nothing but take notes. Do you really think you learned? That professor stood up there and lectured to you for an hour. Do you really feel that you learned? What you learned to do is to take notes. You did not learn to think.
You ruined your handwriting.
You ruined your handwriting. You certainly didn't learn to be creative. What is very disconcerting that they have found is that if you give a problem to a group of 7-year-olds, 8 out of 10 of those 7-year-olds will solve the problem creatively. That means that if they can't solve it one way, they'll look at it and they'll say, well, maybe I should do it another way. Well, maybe I should do it another way. And they'll roll the problem around until they find a satisfactory answer. Only 2 out of 10 adults do that. What we are taught to do is to memorize, to take notes, and to follow formats by the time we get out of school. And you can use that by simply saying, okay, Kiwanis, I'm there talking to Kiwanis, so let me give them the technical definition of the term, and then I'll entertain them for the rest of the time. I thought you gave us some information that was very cleverly put together, and I don't think that you needed the technical term for that. You got it across much more clearly by showing me or giving me the examples. I don't think you have, nor do I think you have to resort to joke telling unless you're comfortable. I don't think you told jokes, but I think you had great one-liners, and they work for you. And they are things that we'll remember. To be honest with you, out of the 50 people you talk to, if you ask 45 of them the next day what an endodontist, give me the technical term for endodontist, they won't be able to do it. But they will remember your story. And they will remember catchphrases like saving teeth. Those kinds of things. They will all, or the canals, I love that, canals I've known and loved, that was great. Those kinds of things we will remember, and that's what you have to recognize from lay audiences especially. I don't know that I would do that for a general dentist audience.
Oh, yeah.
It's a bit too flip. But for the audience you chose, I thought was fine. Anything else, any of the rest of you? You'll see when you play it back, you're behind the podium, and you're behind the podium because you wrote out your text.
Yeah.
Being behind here, you can tell already, first of all, you had gestures and we can't see them. You had gestures down here, but no one can see those gestures because the podium's covering you up. Secondly, although you do a very good job of working with the text, you do read. And as a result, you lose eye contact. But you are one of the very few people I have seen in a long time who handles it pretty well. You're probably better off if you want to do it that way without visuals to use 3x5 note cards.
Yeah, I just didn't have time to put it all together.
Because what happens to all of you, if any of you who write out speeches, Once you write them out, you get very enamored of your written word because you spent all this time writing it out. So you really get attached to it. And if you bring the text up here, you are going to read it. Even if you've memorized it, you're going to read it because it's in front of you. And because you're nervous, and this is not what you do as a profession, you will go back to what you know, and that's the text that's right in front. You did a pretty good job of not reading all the way through, but you can tell when you play it back, you can see almost exactly when you read and when you don't. Your voice changes. It runs off to almost a monotone, like most of us do when we read. How many of you have watched these things on television? You know, the editorial response? And you have John Q. Public, and he's going to come in and he's going to respond to an issue that's important for him. And you know that he's reading off teleprompter because you see the eyes do this, and all of a sudden you know that he is reading because there is no facial response and there is no voice response. And good teleprompter readers not only use facial gestures, which is hard to do, by the way. It's really hard to talk to a camera and use facial gestures. But they never give you the illusion that they read. Reagan is superb at it. Granted, he's been in the business for 97 years, but I mean, he really literally has. He can look at a teleprompter and you never know that he's on teleprompter. And that same thing happens when you do a speech and you run off your text. You can hear, you can not only hear what you do, but you can see what you do when you play it back. You know instantly when you're reading and when you're not. So the 3x5 note cards is showing better. Anybody else have a comment on it?
When you say 3x5 note cards, you don't mean you put the whole speech on it, you just put keywords on
Same
it.
thing you do when you keyword your visuals. You were the only one who brought in visuals that had just a set of words on them. That's what the only difference between putting it on a visual and having the 3x5 note cards here is that the audience can see it. It's the same note, and it's just a set of words. But I'd love to have some of those. People are going to ask you for your phrases. Some of those phrases should be incorporated into some of your presentations. They're great. They really are. They were very clever. And if you are looking for opportunities to go out and talk to the lay public, you do a very good job of that. Have you done this before? Good to know that. Also, and this is just minor, it's true for both of you, and a couple of the rest of you did this today too. Never apologize before you get up in front of an audience. I would assume that you wouldn't do that if it was an actual audience instead of a seminar. But don't ever tell the audience that I'm not prepared or that I was up until 10:30 last night working on this presentation. What you are doing, of course, is that you are cueing your audience to say, if I fail, guys, it's because I didn't have time. The honest fact is, we will never know that you're not prepared unless you tell us. Audiences have no idea where you're going or what you're doing. You can get totally off the subject and basically we won't know. But if you say to us, I'm sorry I didn't have time to prepare this, that colors the presentation for the rest of the presentation. And even if you're good, and you were, I remember your apology. So overall, don't ever apologize to an audience. You can apologize for charging us a lot, for example, or you can apologize if your visual's out of order by simply saying, oops, sorry, that's the wrong visual, let me see if I can backtrack. But don't tell me you're not well prepared. We just won't know that unless you let us know. Okay, anybody else got a comment on it? Okay. Right after lunch.
Very exciting for me. Okay.
I can make a paper airplane.
Good morning, boys and girls, ladies and gentlemen. I want to talk to you today about the dentist who fixes roots, okay? And what that is the little stars indicate, is that I'm an endodontist. My name's Dr. Jim Reid. Now, you can see that we have a real lovely representation of a little plant here. And what do you think we'd see if we all had x-ray vision like Superman and could look right through the pot that the plant's in? Any ideas? Your name's Davey, isn't it?
Yeah, the root.
You're right. Oh. And this plant, as we know, does have roots down in the pot. another question I could ask you ladies and gentlemen is that what do you think would happen if a bird came along, sat on the plant and started eating some of the plant and damaging it, or maybe if a farmer came along and cut the plant off? What do you think would happen to those roots? Well, sometimes they can die, and I think your answer is good too, young man. Either two things have happened. Now, when the plant is damaged, if we nurture the roots, water it, take good care of it, sometimes we can see those roots grow another plant and remain healthy and alive. And as Davey pointed out, the other thing that could happen is that that plant would die. Now, I am a dentist. I don't work on plants, but we do work on teeth. And this is a picture of a tooth, and you can see that this is the part of the tooth called the crown of the tooth, and that's the white part of the tooth that you see in your mouth. But below that, this is the gum tissue. Below the gum tissue, if we had X-ray vision again, like Superman, and dentists do have X-ray machines that they can use to see the roots, and that's what we see in our X-rays. And just like the plant, we have the top part of the tooth called the crown, and then down inside the bone and the gum tissue is where the roots grow to hold that tooth in place. What we want to talk today about is what happens when the roots become unhealthy or diseased, just like that plant that we saw a minute ago. So these are the things that I'd like to talk to you about. I mentioned that I was an endodontist or a root doctor. So what I treat are root canals, little channels in the tooth. And today I'd like to talk to you about tooth disease, reasons for tooth disease, and also the kinds of things that we can do to treat teeth.
Yeah. Let's see, I still have a lot of baby teeth. Do I have any root canals in my baby teeth?
Have you lost some baby teeth?
Yes, a few.
Do you notice how when that tooth comes out, the tooth is a little bit longer than what you see in your mouth, the white part of the tooth? Well, what that is it's a root, and in a baby tooth, the root is dissolved away, so it'll be lost and your big permanent tooth can come in. But yes, baby teeth have roots too. We may treat them a little differently than permanent teeth, but one of the things that we want to have everyone do is just be aware of how important the roots are on permanent teeth and what we can do to save and keep your permanent teeth over your whole lifetime. You don't lose permanent teeth like you do your baby teeth. Now, we saw a healthy tooth a minute ago, and this is a diseased tooth. And usually, when a tooth becomes diseased, there's some kind of injury that occurs to the top of the tooth. But we see the soft tissue on the inside of the tooth, which is called the pulp, become inflamed, just like if you slap your hand, redness and swelling occurs there. And if the injury is bad enough, just like with that plant, and we don't take care of it, we can see that tissue die, little bacteria get involved and break that tissue down, and finally, those little bacteria leak out into the surrounding bone in which the root is implanted and create a little infection in that bone. And at that point in time, you've heard about people that have toothaches. This kind of situation is what causes those toothaches. It's actually a little infection or inflammation in the roots around the tooth. And as an endodontist or a root canal dentist, this is what I treat. Now, we want to talk to you a minute about the reasons people can have problems. Does anybody know who Rocky is here? You heard of Rocky and Mr. T? Okay. Well, one of the things... Excuse me just a minute.
That would impress the kid. Read this. Right.
One of the things that can damage a tooth is when we have boxers boxing each other and they may get hit in the mouth. What do you think happens to those kinds of teeth? How about this little girl here in the white blouse? Isn't your name Henrietta? They bleed. Okay, that can happen, or they can break. We've seen that. Or sometimes just the tooth will be injured enough to where the pulp tissue in the root will die, and we'll have to treat it. Now, other things that can cause a tooth to become injured are things like fillings and decay. I think it's very important that we treat decay. Yes, Neil?
Dr. Reid, what do you mean it dies? What happens when the tooth dies? You said the nerve dies? What does that mean?
Well, basically like the plant that I showed you. When a farmer comes along and cuts off the top of the plant, or when a bird damages the top of the plant, just like decay here, if we let that go, this inside of the tooth would die. And like we showed in that diseased tooth, Neil, after it does die, we get an infection down around the bottom part of the root. And that's what an endodontist has to treat. Now, like with that plant where the farmer can water it and take good care of the top of the plant, the roots will grow again and become healthy. We can do certain things to treat teeth to get the roots to stay and become healthy rather than die and fall out of the ground like the roots of the plant would. Okay?
Well, when my pet gerbil died, my daddy and mommy took me out to the garden. We planted it by the roots of the rose, and it made the rose better, grow bigger.
And that's one thing pet gerbils will do. Now, but it depends on whether you want to keep your teeth too, Henrietta. You know, one of the things that we want to do is prevent that teeth from ending up in the same place that your gerbil did. We want to be able to save that tooth so you can use that tooth your whole lifetime. Okay? Dee Dee?
I was playing with my brother and I hit him and knocked his tooth out.
Okay, and that happens too. That happens sometimes between Rocky and Mr. T.
You put it right back in.
And yeah, and that's what we can do to save the tooth. It's just like if somebody came along and pulled that plant out of the ground, if you catch it early enough, and usually we want to try and see those kinds of things happen within 15 minutes to a half an hour, we can place that tooth right back in the bone and get it to grow again. We have to treat it and nurture it just like you would the plant, but that tooth will continue to grow. Now, if that should occur to you, children on the playground, one of the things that you want to do is make sure that that tooth remains very clean, and if you can, pick it up, and if it happens to you, don't play with the roots very much, but if you can put it right inside the cheek and your gum and just go to a dentist, have your teacher take you to the dentist or an endodontist as soon as possible, we can replace it for you. And if an adult is available, if your teacher's there, she can oversee everything, but the main thing is to just try and recover the teeth and bring them in as soon as you can. We had a little girl call our office the other day, and she was playing soccer, and her coach brought her into the office, but they didn't bother to bring in the teeth. And, you know, without the teeth to put back into the bone, there was nothing we can do to help her, and she now has just a space where her two front teeth were, and we'll have to do some other things, make teeth out of plastic to put in there, but they're not as good as your real teeth. Okay, the things that an endodontist does to treat teeth is, the first thing we do is use little tiny files, sort of like He-Man's sword, only these little tiny files are about this big, and they go right down into the top of the tooth, a little opening we make, and we clean that tooth just spick and span on the inside, so there are no little bugs or bacteria left.
Isn't that gonna hurt?
When you put those needles in there,
No, it doesn't hurt at all. Now, you're old enough to have been to the dentist a few times, and you know that we use local anesthetics to put that tooth to sleep, a little shot, we do, to put the tooth to sleep, and we can accomplish our cleaning procedures with you being very, very comfortable. We isolate the tooth in a little rubber dam or a little raincoat that we stretch out around the tooth to keep it clean, and that's one of the goals that we want to do. We'll just go back again to the tooth with bacteria and dead tissue in it, and this is all the debris that an endodontist wants to clean out to be able to save your tooth. Now, after we've cleaned out the tooth, to keep that area clean, If we just left it open, we'd see more little bacteria enter that root canal. But to keep it clean, we want to place a filling down inside that root canal, and we usually fill your tooth with a rubber-type material that acts just like a cork in a bottle to seal off that root canal. And what that does is that it cleans, keeps the area clean, and allows that infection to heal.
That looks like a Boston technique, doctor.
That's very perceptive, young man.
All those little worms sticking out there.
Well,
My gerbil's name was Herpes.
the name of the tooth, or the pulp of the tooth forms by tooth structure being manufactured around little blood vessels and things. And actually the pulp acted to form the roots of your tooth. It was what caused the roots to grow. Just like in a plant, the roots start from the ground and grow down into the ground. Well, this tissue caused those roots to grow, and after those teeth have reached maturity, this tissue really isn't essential to keep the tooth healthy and functional, and what keeps the tooth nourished is the bone and soft tissue all around the tooth, just like the plant gets its nourishment from the ground. So once we treat your tooth and stabilize your tooth, you can have it forever and ever, and what we end up with is Mr. TT, a tough tooth. Yes?
Yeah, I had a baby tooth that was hit and got dark, and I had a root canal, but it didn't look like that. The dentist showed me a picture of it, and it looked a little bit different.
Well, it could have been a front tooth, like I showed you before, Hank, or, excuse me, Walt. This is what front teeth look like. Every tooth is a little bit different. Front teeth just have one root, and as we saw before, that other tooth was a back tooth that had two roots. So every tooth is a little bit different, and as an endodontist, we have to treat those roots a little bit differently.
My sister had some kind of something done to her tooth, and her tooth is all sort of gray.
Okay.
Is that because it's dead?
Well, it's because there was some damage done to the tooth. The tooth isn't dead at this point, Greta, because as I talked about before, the bone and soft tissue is nourishing the root of that tooth to keep it alive. It could be that, just like with Rocky and Mr. T when they fight, if the tooth was knocked hard enough, it could have gotten a little bit stained on the part that you can see. And what we can do as endodontists is we can put a little bit of bleaching solution in there to bring your little sister's tooth back to a white, normal-looking tooth.
I mean, it doesn't have to stay ugly then.
No, it doesn't have to stay ugly. I'm sure your sister's a very beautiful little woman.
I went to the dentist yesterday, I didn't have a single cavity.
Well, we're proud of you, Brad. That's the way it should be. And as endodontists, we don't want to treat all the teeth. We just want to, if possible, prevent you from developing these causes for root canal problems. Just like with the plant, we don't want the bird to come along and eat it. The farmer uses scarecrows and other things to keep birds away from his plants. And if we can brush our teeth and keep our teeth cleaned and flossed, we can keep the bacteria away from teeth and prevent problems from occurring. But, you know, sometimes there are little incidents like a baseball coming and hitting you, and the things that we have to do in those cases is just deal with the situation that we have, and if we can help the injury, we will do that to save your teeth. Any other questions, children? You're a very good class today. I'm proud of you.
Great.
I think you should go out tomorrow. No, not tomorrow, Sunday.
Really good.
Aren't those marvelous?
Good idea.
Yes. You could take out, Jim, you could take those out on Monday and use those for a group. You do a couple of very nice things. First of all, he doesn't talk down to us. By the way, it's hard to do this in here.
Well, I feel myself
real.
like you're doing Mr. Roberts.
Right, you did, a little bit.
Yeah.
Well, in fact, we've talked to quite a few dentists who do this in Chicago routinely, go out for American Dental Week. They do wear sweaters. That that's exactly what they do. They call it Mr. Rogers' symptoms because they recognize sometimes that children are afraid. And quite a few of them in Chicago, I know 2 of them in Chicago who dress exactly like that. They don't go in a suit. They don't want children to see. I mean, you've treated children before. They don't want children to see them as this rather authoritarian dentist with a big grill in his hand. And they found that by wearing the sweater, children under about the 5th grade will identify with them. But that's a better technique than coming in a suit. And yes, what you've done very well is that you know that we're not kids in here, and you did a great job of play rolling this whole thing. Do the visuals work?
Yeah. You know,
Yeah.
on like dental health week and all that stuff, sometimes you think that it's not really applicable to us, but you know, the things we have to tell them are probably the most important things they need to know. I mean, you know, a traumatic injury to a tooth or something, that's playground kind of stuff. That's their age group. And prevention and decay and what happens if you do have a root canal or something like that. So it's, you know, I think it's appropriate material.
In fact, that little brochure that you have with the little Ziggy character, that's one of the reasons I want to send it back to you, because if you can take those and make those into a set of transparency, that's the kind of presentation that kids will identify with, and they should know that, because children are going to lose teeth out in the playground.
And the teacher picks up on that. He tells the school nurse or whatever, and the school has a problem, and they're thinking about you.
Have any of you ever done school presentations for American Dental Week?
I have, but not.
Well, I had
Surprised me.
but related strictly to dental dentistry,
Yeah.
to brushing your teeth and, what is a tooth and
That's really good.
not talking about.
Well, that's fine, but I think this approach where you've gotten your objective across and you've made it very clear to kids what it is that you do, and at the same time you've answered their questions and you've gone back and you've said these are the things that you should do. The analogy between the teeth and the plant and the other things is just work very well. Those things should be made into a set of visuals for use for probably even juniors and seniors in high school. You would just change the language side. That's all. But there's no reason why that can't be used. And it works very well. I mean, we knew we weren't 3rd graders. We were having a great time. Those are the questions you get from 3rd graders. Anybody else have a comment?
I thought that maybe some of the terms he used might have been, could have been substituted with a simpler term maybe for 3rd grader, like a sick tooth as opposed to a diseased tooth, or germs instead of bacteria.
Germs instead of bacteria. Although I think children are much more sophisticated than you give them.
9-year-olds are, hey, in fact, it's a couple points I thought you might be even talking.
I don't even know what a 9-year-old is.
Those kids are pretty smart. First of all, they've been on a computer since kindergarten. They're much more aware of the world than we were at 19. They don't know an awful lot about it, but they certainly have a broader perspective of it. But the only one that I would have said you probably could have substituted would have been germs for bacteria, simply because that's just easier. You don't want audiences to translate. Not that they don't know the word, but you want them to translate, which then holds them up for a few seconds as they translate in their head. Oh, that's what he means, because then you've lost them. But I think the rest of the terms you probably used were just the terms it should have been. I would not have used bacteria. I would use them. But that's the only one, and I think that...
I got a 3rd grader who came home and he was telling me technical terms. And the teacher told him that about teeth. I mean, I didn't know.
As far as disease teeth, they would know that.
He told me bacteria, plaque, acid. He told me the whole.
Oh, and again, everybody knows. Everybody knows plaque thanks to Crest,
Well, yeah, I think
because Crest has now got the commercials
I don't
out.
think you overplayed it.
No.
I didn't know exactly where I was, but I think you could either downplay it or upplay it.
Sure you can.
Tell how they talk.
Sure you can. And you can also, if you really had 9-year-olds in there, you would have adjusted instantly. You can tell right away the kind of response that they're going to give you. I mean, the story of the gerbil and they buried it is exactly what you get. And I thought you just handled that beautifully. That's what gerbils do. And that's what we want you said that you keep it. You did a very good job of that. Did you have any trouble with the visuals? It didn't seem as though you did. They worked very easily for you.
You kind of fumbled in the...
On a couple of those, Jim, you probably could do a couple overlays on your tooth. The one with the disease and the one with the fill.
Yeah.
They
those are fantastic.
Yeah.
Those are a good idea.
Yes, those really should be made up in the hard copy so you can all use them. Because if you get a library of these and hard copy, whether you have the slides or not, you will make them into transparency. Because it's so easy to have your secretary put them on frames and then just take your pens and add color where you want them. And that especially will work from probably 6 years, it'll probably work for adults. I mean, we're adults, we thought they were great. I love the lips, I thought that was marvelous. When you said Rocky, it took me a minute to realize you weren't talking about the Rocky Horror Picture Show. You can tell I have teenagers instead of 9-year-olds. I'm thinking, what are you talking about? You know what the Rocky Horror Picture Show is? None of you know.
Or Rocky and Bullwinkle.
The Rocky Horror Picture, the cult movie with the lips? With the transvestite, you don't know that movie. Don't any of you have teenage kids? They're not telling you. You don't watch it, you go and see it at midnight. Maybe Seattle doesn't have it.
The show,
And you participate? Yes, I was bragging on see. You participate, you throw right at the screen and you all yell. You've not heard about this cult movie? And
they show it at Halloween, and they stand in line for hours.
dressed up as transvestites and, yes. And those are the Rocky
I've
lips.
seen it,
It's got
but-
Rocky lips on there, and that's why I thought, my gosh, 9-year-olds don't know about Rocky Horror Picture Show today. Maybe they do, maybe they do, and they don't. Okay, but it was nice. You have a nice feel for it, it's a good attitude, and you could take that out anytime, exactly like that with those visuals. You can take them out and do them. And they worked well. You did the same thing that Brad did. You went through the information, and when somebody else asked you a question, you picked up one of the transparencies you'd already used and put it back up. And when you're working with 5 or 6 or 7 transparencies down here, you can do that at a time. You can't do that. By the way, if you get 20 visuals,